Welcome to our channel. If you're pregnant and need affordable maternity care, follow these step-by-step instructions to access quality prenatal services. Step 1. Apply for Medicaid or CHIP for pregnant women. Most states provide free or low-cost coverage to pregnant women with incomes up to 200% of the federal poverty level. Step 2. Contact your local health department about maternal health programs. Many counties offer free or reduced cost prenatal care services regardless of immigration status or insurance. Step 3. Visit federally qualified health centers for prenatal care. These community clinics provide comprehensive maternity services on a sliding fee scale based on your income. Step 4. Enroll in insurance through the healthcare.gov marketplace. Pregnancy qualifies as a special enrollment period, allowing you to get coverage outside the annual open enrollment window. Step 5. Look into hospital charity care programs. Many hospitals offer financial assistance for maternity services if you meet income guidelines, potentially covering prenatal care and delivery. Step 6. Contact organizations like Healthy Start or March of Dimes. These groups connect pregnant women with resources including free prenatal care, education, and support services. Step 7. Ask your obstetrician about payment plans for uninsured patients. Many providers offer significant discounts for self-pay patients and will arrange affordable monthly payments. Step 8. Apply for WIC nutrition assistance. The Women, Infants, and Children program provides free nutritious food, nutrition education, and healthcare referrals for pregnant and postpartum women. Don't forget to like this video and subscribe to our channel.